Dr. Eskander, what are some common barriers that patients with endometrial cancers face in accessing care, especially in underrepresented communities?
The issue around access to care and disparities in care is an important one. And I will say that as we move to this world of more molecular testing, identifying changes in the tumor or in genetic findings that predispose patients to potentially responding to therapies, there's concern that it may increase disparities in cancer outcome. And that's because, is everybody getting access to tumor testing? Is everybody getting access to genetic testing? Are they informed? Are they educated about the implications? This is so complex, and I think, Lisa, we could talk for an hour just about the issues surrounding barriers to care, disparities in outcome. I will say that the goal is to make sure that all patients have access to these important tests. The goal is to make sure that all patients are educated to the same capacity, understanding that health literacy can vary quite substantially, so that we can work to try to develop more equitable treatment approaches and improve clinical outcomes across the board. Do we see barriers? Absolutely. It could be barriers related to language. It could be barriers related to travel, that a patient may not be able to travel the distance needed to see the provider or the specialist that can provide them the treatment that they need or the counseling. It could be copay costs can be prohibitive. It could be concern, trust issues around, do I want to get genetic testing? I'm worried this information is going to be used against me rather than help inform my cancer treatment strategy. So it's layered, it's multi-pronged. There are several initiatives that are being deployed at different centers to try to improve and break down these barriers so that we can help patients overcome. And these could be social workers, patient navigators, case managers that reach out to these patients, resources that are available to facilitate transportation and bridge gaps that some of these patients might be facing. And this is just in standard of care, completely independent of the barriers that patients face when they look to enroll in a clinical trial, for example, for treatment of their cancers. My activation tip is we have to be committed to this. This is not just a patient issue. This is an issue that is shared, a responsibility that's shared across institutions, clinicians. I would strongly suggest that patients advocate for themselves. Don't be afraid to ask questions. Try to determine what resources might be available to assist if you are facing particular obstacles to help mitigate some of the barriers that may impact treatment in this era.